Dr. Ritwik Burdol. I'm a consultant physician and diabetologist. I run a clinic named RV Specialty Clinic in Nandini Layout, Bangalore. Welcome everybody. Today here we are to talk about hypertension. Understanding hypertension. Our today's discussion will be about what hypertension means to the public and what high blood pressure is and how to prevent it. Generally, everyone would like to have a healthy or a normal blood pressure. But what exactly does that mean? Basically, each time the heart beats, it pumps blood into the blood vessels. This creates a pressure against the blood vessel walls, and this is called as blood pressure. It rises and falls throughout the day. But when the blood pressure remains high for a longer period of time and if left untreated, it can lead to serious health conditions. In general, a persistent increase in a blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time, and it can happen because of multiple reasons like unhealthy lifestyle, for example, inadequate physical exercise, obesity, smoking, alcohol consumption, and stress, and many more other factors. Other factors that increase the risk of developing hypertension are: 1. Age. Age is the most important risk factor. As people get older, the arteries stiffen up and they cause narrowing of the blood vessels, and the fat buildup is the reason for increase in hypertension. A family history of high blood pressure is another reason. One or more family members with hypertension increases the risk of the condition for the patient. Excessive salt intake is known to increase blood pressure. Not eating enough foods which contain potassium can also be the reason for increase in blood pressure and increases the risk of stroke as well as chronic kidney disease. Eating processed foods and fatty foods throughout the day makes the heart work faster and hence causing increase in blood pressure. On the other hand, lack of physical activity is also linked to obesity and further leads to increased blood pressure. One more reason factor for increasing blood pressure is basically stress. Reacting to stress in unhealthy ways and not managing stress are also some of the causes for increasing blood pressure. What are the signs and symptoms of blood pressure? Blood pressure does not have any obvious signs and symptoms, and hence it's sometimes called as a silent killer. It puts several patients under risk because it doesn't have any symptoms, and it increases the risk of cardiovascular diseases, stroke, kidney failure, and even sometimes eye damage. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to know whether the person has a high blood pressure or not. Generally, when symptoms do occur, they usually are associated with early morning headaches, tiredness, vision changes, and buzzing of ears, sometimes fatigue and nausea and vomiting. But however, this is very unlikely that it happens. If a person is experiencing some of these symptoms, the patient should get his blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called as a sphygmomanometer. A blood pressure recorded in two numbers. One is the systolic blood pressure and one is the diastolic blood pressure. Now let's try and understand what these two numbers actually mean. A healthy or a normal blood pressure should be less than 120 by 80, or it is also read as 120 over 80 millimeters of Hg. Hence, the upper number indicates the systolic blood pressure, the lower number indicates the diastolic blood pressure. If the blood pressure is more than 140 by 90, then the person is said to have hypertension. If the person have high BP levels, then he or she might be at a higher risk of developing a serious cardiac condition. On May 17th, we celebrate the World Hypertension Day, a day which is dedicated to highlighting the importance of monitoring blood pressure and its global awareness to the 1 billion people who are living with high BP currently. The theme of this year of World Hypertension Day is to measure your blood pressure, control it, and live longer. Ensure that the hypertension is always regularly checked up, and if not controlled, take adequate medications. And this risk can be prevented. What lifestyle changes can we do to prevent this hypertension from occurring? Regular exercise is the most important activity which is recommended. A simple walk of around 30 minutes every day is known to decrease hypertension or prevent it to a certain extent. A healthy diet, which is predominantly a high potassium and a low sodium diet, is recommended. Quitting smoking and alcohol intake, regular blood pressure monitoring, since it's an asymptomatic disease, regular BP monitoring helps. Stress management through meditation, yoga, and relaxation exercises Adherence to medicine is very important in preventing the long-term complications of hypertension. If the blood pressure is controlled with lifestyle modification, then it might avoid or delay the need for medication. So let's look at the strategies one by one. Exercise can be a drug-free approach to lowering hypertension. Regular physical exercises make the person's heart feel stronger. If one has a strong, healthy heart, it can pump more blood with less effort. So if the heart has to work less to pump, the force on the blood vessels will decrease and hence decrease blood pressure. Second, healthy diet. Diet plays an important role in controlling hypertension. A diet with a high fiber, high fruit, high grains and vegetables are recommended for hypertensive patients. For lowering the blood pressure or preventing hypertension through dietary mechanisms, one can follow one of the following diets. One is called as a DASH diet, which is basically a Mediterranean diet. Eating less saturated fats, which can control one's blood pressure 11 millimeters of Hg. Reduction of sodium in diet. Even a small reduction in the sodium in diet can improve the health of the heart and reduce blood pressure by around 5 to 6 millimeters of Hg. To decrease sodium in your diet, consider the following tips. Read the food labels before. So we are hugely associated with eating processed foods now. So processed food contain a lot of salt in it, and reading the food labels will give you more information about the amount of salt in the food which you're consuming and hence help decrease the food intake. Obviously, better than seeing the food label, avoiding these processed foods is the best way of decreasing salt intake in the first place. Adding table salt to food on a daily basis to be avoided. The salt which is contained in the food is adequate usually, no table salt to be added. Ideally speaking, that helps. The third thing which we can do is, if a patient is associated with smoking, stopping smoking will reduce your BP to a quite a amount of level. Quitting smoking can also have other beneficial effects to other parts of the body also, and quitting smoking is more or less self-explanatory for decreasing the risk factor for hypertension. Regular BP monitoring, but it is not always possible for all patients to visit doctors every time. Ambulatory BP or home BP monitoring can be used for such patients. Self-monitoring helps the patient to measure BP at different times of the day over a longer period of time. This also assists the doctor to get a more complete picture of the person's blood pressure readings at different times, and helps him make better predictions for cardiovascular morbidity and mortality rather than a single routine office BP monitoring. Another method of decreasing thing is taking care of stress management by learning how to relax, manage stress through yoga, meditation, a simple walk in the park, listening to music, whatever your kind of relaxation exercises are. Decreasing stress goes a huge way in taking care of hypertension. Adherence to medicines. The most important is the point which I am taking now. Adherence to medications. A medicine used to lower blood pressure may be recommended by your doctor for decreasing BP if it is more than 140/90. Adherence to medications is very important. Patients think that if you stop continue hypertensive medications for a long period of time, it will lead to kidney damage and other adverse effects. All of these are unwarranted concerns, and in fact, not taking hypertensive tablets will lead to kidney dysfunction and not vice versa. So at last, I would like to suggest there is nothing more precious than having a fit and a healthy lifestyle. Adapting a healthy lifestyle makes us enjoy life more and have a healthy, uneventful life. High blood pressure can be prevented and is a preventable issue, and hence the complication associated with hypertension also is easily prevented by monitoring high BP on a regular basis and having adherence to the tablets which has been prescribed, and following the healthy lifestyle tips which have just been given before. Thank you.